Erectile dysfunction is the inability to initiate or maintain an erection that is satisfactory for sexual intercourse. Now, the definition sounds boring, but we ought to talk about erections first. Erections are plain and simple hydraulics. If you'll think about it in this way, when you're stimulated, there's a signal that goes from the brain down to the penis. And these are your nerves. This is the battery that powers your erections. You've got two tubes in the penis that, with that battery input, fill with blood. The outflow completely caps off, and at the end, you have a firm erection within a fixed fluid chamber. When you get ED, it's typically one or multiple things during this entire process that has gone wrong. To all men watching this video out there, if you don't take anything else away from today, I want you to remember one thing, and that is that erectile dysfunction, or ED, is extremely common. Men just don't like to talk about it. By the time men are 40 years old, approximately 50% of men have ED. By the time you're 70 years old, approximately 70% of men have ED. And so I want to encourage you today to seek your doctors and talk to them about ED. Now, as I mentioned in a former video, ED is inevitable in all men. We were never designed to have sex until the day we died. Now, it doesn't mean that we can't, but perhaps the most common risk factor for ED is aging. To put it simply, hydraulics fail. Now, with that said, there are several conditions that may also progress the erectile dysfunction perhaps a little bit faster. Those conditions include cardiovascular diseases, metabolic syndromes, depression, things like high blood pressure or diabetes, as well as a whole host of surgeries such as prostatectomy or colon cancer surgery, as well as many other surgeries that result in erectile dysfunction. Erectile dysfunction really is a subjective diagnosis. It's simply based on us having a conversation and you telling me what's going on. In other words, there are no specialized tests that you absolutely require in order to diagnose someone with erectile dysfunction. Now, with that said, I may recommend specialized testing in the form of a special penile ultrasound that may help us categorize your erectile dysfunction in a better way. Once again, as I said, ED is somewhat inevitable in all men, but that doesn't mean that we can't do certain things to improve our health and perhaps reduce the progression of erectile dysfunction. The most important things I tell patients is to be the healthiest self that they can be. I tell men that ED really is a harbinger or precursor to cardiovascular disease, so take control of your health. Exercise regularly. I ask men to put in about 30 minutes of cardiovascular exercise every day for 5 days a week, as well as work on eating a really healthy diet. I want to point out to you that your primary care doctor is doing a wonderful job managing a variety of conditions that they're helping you with. And I'd like to point out that the most important thing about seeing a men's health specialist is that I really focus on one or two things, and the goal is to get you to the results that you want as quickly as you want. Now, I do want to caution you about certain practices that are out there. It is important to see a men's health urologist and not just a men's clinic. Men's clinic is a business that simply profiteers by providing you certain injections and pills. They are not equipped to give you the entire host of treatments that are available for the treatment of erectile dysfunction. What I enjoy most about treating ED is that you and I drive this ship together. We make the decisions together on the right treatments. It's not like seeing your cardiologist or heart doctor who recommends a certain type of medication for you and you just have to take it. With that said, treatment of ED is unique. Every man is every man is different, and so each treatment is very much individualized to that person. The treatments vary from simple pills all the way to complete freedom with a penile implant. The biggest takeaway is when it comes to ED, where there's a will, there's a way. As I mentioned in the previous video, each man is different and therefore his needs are different. So there is a right treatment for each person. Now, there are some men that come to my clinic and ask me to try everything possible before a penile implant, and that's perfectly fine. There are other men that walk into my clinic and say, "Hey doc, I want a solution that's one and done. Give me the penile implant." And that's perfect for that person. And so I say, look, let's sit down together and figure this out together. You know, the truth is that each treatment option carries its own success depending on the person. So pills are a great solution for a lot of men. But what we find is that over time, the pills do become somewhat unreliable. And this also holds true for injection therapy. The reason being is that we are simply recharging or rebooting that battery. We find that perhaps the penile implant has the highest satisfaction rate purely because we're replacing all the hydraulics in your system. I think this is a really important question. You've all heard of the saying, use it or lose it. This holds entirely true for the penis as well. Just like the muscles in your body, the penis is composed of smooth muscle. So when you're not getting regular erections, there is a period of atrophy or loss of muscle tissue that results in you losing length as well as girth. So once again, going back to the analogy of having a fancy car, you want to keep running it in order to keep the engine moving. And so it's extremely important to keep having regular erections.